Welcome to Stimulate Conversations, a sexual wellness business discussions podcast that supports the vast range of professionals supporting consumers from a business perspective within the sexual wellness space. My name is Nicole Lameck, your host, and the founder of Stimulate, a B2B sexual wellness trade show held annually in Nashville, as well as many other Stimulate experiences throughout the year. I'm also author of the book Retail 101 from McGraw-Hill and professor of retail marketing at Columbia, Chicago. From head to toe, young to mature, purpose to pleasure, Stimulate Conversations is committed to supporting sexual wellness professionals. Together with industry leaders as our guests, we look forward to delivering trusted and important conversations to help support retail, wholesale, spa, salon, and medical professionals who collectively want to help elevate and support their consumers within the sexual wellness community from an educated and professional perspective. Listeners of Stimulate Conversations can look forward to gaining expert-led insight from industry leaders, ranging from doctors to retail operational experts to industry visionaries and more. Without further ado, let's dive into Stimulate Conversations. Welcome to another edition of Stimulate, where I am so excited to welcome Los Angeles-based urologist, Dr. Ashley Winter. Dr. Winter and I have had the pleasure to speak a few times, and I am so excited for her to share her intense wisdom today with you and reveal a lot about who she is, what she does, and how it can benefit you. Please welcome Dr. Winter. Welcome, Ashley.
Hi, thanks so much for having me on. I'm very excited to be here.
So excited. And with that, if you could please tell our listeners who exactly you are, that would be amazing. Just your professional history and how you've gotten to where you are today.
Yeah, sure. So, first off, I am a board certified urologist. I know we were talking about this before. So, some people may wonder what exactly is a urologist. A urologist is a physician who specializes in medical and surgical conditions associated with the urinary tract and sexual function. So, we deal with the kidneys, the ureters, the bladder, the urethra, but then also the testicles, the prostate, the penis, and on the female side, conditions with sexual dysfunction, arousal, erection, because women can get erections too, and all that good stuff. So yeah, it's a pretty specialized field, but also one that's in a way broad, and a lot of really phenomenal work being done in urology that has intersectionality with other work, specifically when it comes to women's sexual health. Certainly much intersectionality with gynecology, and other fields. So that overall is what a urologist is. We have to do many years of training. After 4 years of medical school, I did 6 years of residency, and then I did a 1-year fellowship in male and female sexual dysfunction. So actually the only fellowship for urologists, I believe, in the world that does sexual medicine for all genders, and I'm very proud of that. After my fellowship, I was practicing as an attending for 5 years at a large managed care organization. And then I actually left that to explore more business and entrepreneurial opportunities, because I felt that the sexual health space needs a lot of world building and needs a lot of experienced clinicians at that table. So that is the short and long answer. Yeah.
Amazing. I love that you've really taken such heart and really have dove into sexual wellness of both men and women in combination with business. And, as I mentioned, I've had the pleasure of speaking with you in the past. So I know that you've really stepped outside like a traditional medical practice footprint, if you will, and you've explored a lot of different things, which we're going to talk about today. So I want to kick it off and talk about first, what a picture of sexual wellness, like true sexual wellness. Things are going well, things are strong, going positive for men, women, or whatever gender someone may identify with. What does that look like for sexual wellness in a healthy place?
Sure. So I would say that I am expert on the physical side of things. Certainly, the interpersonal um, component is I leave to other experts. But
Mhm.
when I think about sexual wellness from the standpoint of your body, it's your body being allowed to go through the phases of sexual activity in the way that you would like to and have an authentic, pleasurable, exciting experience, right? And so, what that typically breaks down to is a few baskets. So, first would be desire, then there's arousal, and then orgasm, and then kind of the fourth component there is what we say being pain free. Um, so if you're able to move through all of those, and desire, of course, well, all of these can have an interpersonal and, um, you know, psychologic component, and then also a physical component. Um, so moving through again, desire, arousal, orgasm, um, eh, being pain free in a way that is exciting, pleasurable, meaningful to you, is to me the definition of sexual wellness. What would you say? That's probably like a very dry explanation of sexual
Not
wellness,
at
but
all.
yeah,
No, it's interesting that you did mention, you want to make sure, of course, pain free, but also like there's that inner component. And we always say it stimulate. When we define what stimulate is, which we are, of course, a sexual wellness community that supports a trade show, we have podcasts, we do a variety of events, but we are head to toe, young to mature, purpose to pleasure. And one of the big reasons we say head to toe is because mentally being in place of content and that desire and arousal, it's not just that physical emotion, but it is in fact a mental experience as well. And of course, young to mature, which that actually leads me to kind of the next point of this conversation with you. One of the things that you have such a huge interest in, and I know you've spent an intense amount of time studying, is the dysfunction of sexual health and what that looks like.
yeah,
And so that can come really at any age, I suppose, but certainly aging individuals, it might be more heightened in. So I'm curious about the sexual dysfunctions and what you can share with us. If you could paint a picture to us what that might look like from both a male side and a female side.
yeah. So I always am saying this, but sexual health is health. And what I mean by that is it is a window into your body system function in a very nuanced way. So it is not isolated. It is a part, right? Your ability to have desire, your ability to have arousal, meaning either lubrication of your vulva, development of precum, erection, right? Have an orgasm, have adequate sensation, have absence of pain. These things are a manifestation of a healthy working cardiovascular system, a healthy working nervous system, intact sensation, and overall fitness, right? So um, we know for a fact, actually, that certain sexual dysfunctions, so a breakdown of some of that sexual wellness, actually precedes other important health events by even a number of years. So, the most studied phenomenon, for example, is erectile dysfunction. And what we see is that in men with erectile dysfunction, there is an increased risk of future mortality, uh, cardiovascular disease, stroke, heart attack. Um, so it's and I'm not talking about erectile dysfunction from performance anxiety, but erectile dysfunction that you can see manifest outside of a partnered situation. So, for example, a new lack of morning erection, a lack of what we call nocturnal tumescence, maybe difficulty obtaining an erection, in a safe solo environment. So it is important for people to kind of pay attention to that, because our sexual function is so dynamic, and it really is the window into the soul of our body. So in terms of what those sexual dysfunctions can specifically look like, right, I mean, a really common one that most people are familiar with is erectile dysfunction. That essentially being, a reduction in the rigidity of the penis, right? And so it doesn't have to be a complete loss of erections, but it can be, it's not as hard as it used to be, right? Or I cannot penetrate, or I cannot stay hard enough to, develop the friction I want to develop. So, kind of being attuned to some of those changes, that can be one sexual dysfunction. Um, in women, the equivalent is also erections, and I'm going down this like long path, but the clitoris has erectile tissue, and the clitoris, when you become aroused, becomes engorged with blood and becomes harder, um, and that helps with sensitivity, and that sensitivity in response to physical stimulation can allow orgasm to happen, right? So that's a component. Another component of female arousal is increased blood flow, not only to the clitoris, but also to the vagina, to the area called the vulva. And that leads to swelling of the labia. It leads to becoming lubricated, right? So um, you can be like dry when you trying to have sex because of performance anxiety, because of a lack of hormones, but it could also be a manifestation of cardiovascular disease, which is really interesting, and a lot of people do not know that. So there is definitely an equity issue in terms of understanding um, the way that sexual function or dysfunction can tell us about our health. From what the attention men get to that, and the attention women get to that. Um, and
And
then
just
at the
so
final
you want
frontier,
me to ask a
oh yeah,
quick question real fast, just
yeah,
so I'm clear, I have to imagine that has to do with blood flow attached immediately to that cardiovascular component, but also for men and women, is this the case? It could be an indication of cardiovascular health, or for that matter, issues with health within the cardiovascular range on both that women's clitoral side and the men's erection side. Is this right? I wanna
yes,
make sure I understand.
definitely,
Okay. Okay, good, because
yes,
certainly I'm not a doctor, and I wanna make sure for clarity I was following that the right way. So,
yeah.
okay, so very, very fascinating for sure. I love that you even earlier said that you look at sexual wellness as wellness in general, health in general, which I do think that's the taboo that sometimes society does not necessarily connect with. They think it's almost like separated, where in fact it truly is collectively so important to your overall health.
Well, that's the thing, right? I mean, let's say you go in for your checkup to your doctor, and if you were going to have trouble seeing or hearing, or you had pain in your knee, or you were having bad headaches, right? You would feel like those are all valid things for you to talk to your internist about when you go for your
Right.
checkup, right? But if you were having an inability to have an orgasm, an inability to become lubricated, an inability to undergo sexual activity pain free, whether a man or a woman, would you feel that it was as appropriate to say to your physician, I'm having these problems, as you would for you to say, I'm having trouble hearing or having trouble walking? I mean, would you
I
feel
can
like
tell
that?
you,
Right?
thankfully, I am not shy, and I certainly would, but I know that's not how most consumers or patients are, right? So I think that that
Yeah.
is an issue, and I think that having these conversations like we are today, society beginning to introduce sexual wellness products on mainstream retail shelves, like we've seen with Bloomy at Target and various other retailers who have introduced these products, is incredibly important to overcome this taboo and to start to make sexual wellness very a dinner table discussion, if you will. Because if my hearing was going bad and I said at the dinner table, "Oh, I can't hear out of my right ear anymore," nobody was going to flinch. They'd be more concerned. But if I
Right.
said I'm having vaginal dryness, they might all perk up and be like, oh my God, what's going on? So
I know. Why are you talking about that? No, totally. And I
so-
should make a caveat, right? It doesn't mean that everybody who's having dryness or everybody who's having erectile dysfunction has cardiovascular disease, but it can be a marker for cardiovascular disease. And it should be something that you feel comfortable talking to your physician about so that you can be assessed as to whether or not that's the case. And, you were talking about consumer products and sexual health products. And I think when we what's the holy grail with a lot of wellness products, right? And it's to give you a better, happier, healthier, longer life, right? And if you could say to somebody developing wellness products, hey, this product will tell you for a fact that you're at higher risk of dying, higher risk of heart attack, higher risk of stroke, all this stuff. And this specific product can tell you that years before anything else, you would say, oh my God, that's amazing. Right? And that's what sexual health can do. And that's why it is so important for people who are interested in developing and studying or being a consumer in the wellness space. That's why sexual health is so important, because it is exactly that. And sexual dysfunctions can potentially predate major health events. So it's huge.
It's incredibly huge. And I want to kind of step into that consumer space again in this conversation and talk about products a little bit, because I know you've had, some incredible participation in the development of products and research of products. And, there's, you and I were discussing earlier, FirmTech, which is founded by Dr. Elliot Justin. But you, and maybe you can explain this better, you in fact work directly with FirmTech. Is that correct?
Yes, that is correct. So I have two roles there. The first role is that I am just on the General Scientific Advisory Board as a urologist. And so I have been involved with certain products that are already on the market and studying them. So, for example, we have a smart cock ring, essentially, and that can tell you the duration and hardness of your erection while you wear it, which is very cool because, again, you could use it to say, oh, am I having long, kind of look at my erectile fitness and say, what does that mean about my overall health and wellness, right? I mean, the ring also just is a great cock ring. So if you're looking for it, looking to use it for sexual enhancement, that's very exciting. The other specific project I'm working with on that is publishing our data showing that you can actually wear that ring safely all night, which is really important for two reasons. One, because looking at nocturnal erections, right? So erections that people have during their REM phase of sleep, which is the rapid eye movement phase of sleep, again, is a very sophisticated marker for health. And also, too, saying, oh, we know because we have all these tracings for 8 hours or more that it's safe to wear this cock ring overnight, right? And a lot of times we have, for people who are familiar with the sexual health and wellness space, and particularly with cock rings, there is a concern that if you, let's say, fall asleep with it on, that you could damage your penis, which is why, as a urologist, I never recommend metal cock rings. But we know because we have all these tracings that it's actually safe to wear this specific ring overnight, which is very cool. So for people who like to, roll over and snooze right after they have their orgasm, this is a great product. So that's my first thing. And then my second is I am involved with leading product development for a female device made by FirmTech. And that's essentially going to be a Fitbit of the clitoris, if you will. That's not the name. We haven't made it yet. Somebody said clit bit, but that sounds like somebody's biting your genitals. So
some people like that.
But
right, no judgment.
yeah, I don't know. But yeah, with the idea also being that we need true equity when it comes to
Sure.
our ability to understand sexual function for people who have a clitoris, right? And we need to be able to wear a device overnight. If we're making a device you can wear overnight to see penile erections, we should make a device that you can wear overnight to show clitoral erections, right? I mean, the organs work the same way, and we deserve that
Makes sense.
equity in terms of our what we do and what we research. So it's a very exciting. The product is still in development. We definitely are still working on our R&D. So if people are interested in investing in the women's sexual health space, let me know. And
Well,
I'm very excited for things to come there.
Well, you beat me to the punch there because I definitely want to make sure people have a way to stay in touch with you. What is the best way if someone wanted to follow up with you for them to do so?
Yeah, my social media handles are all Ashley G Winter, so ASHLEY like grape, and then winter like the season. So that's me on Twitter/X. That's me on Instagram, and then also on TikTok, although I'm not on TikTok very often. And that would probably be the best way to reach me. And then I also do have a physician Facebook account. It's Ashley Winter MD, but I don't check that very often either. So that is those are the ways.
That's fantastic. I love that. Well, we're definitely going to be sure to stay in touch as the development of these products continue. And we do, in fact, have the inventor of the firm tech, Dr. Elliot Justin, joining us for a future episode, which we're super excited about from Stimulating Conversations. So if you could share any insight to listeners in regards to supporting the dysfunction of what they might perceive as dysfunction, I should say, because they might not really know the depths. But what is your advice to those listening about, hey, if they think something's wrong or if they're curious if something isn't working the same? And of course, there's maturing generations and things do change as we mature. What's your advice to them on how to handle that?
Yeah. So, I mean, definitely, if you feel comfortable, and I hope you do, try talking to your primary care provider. If you feel that's not the right fit, you can certainly reach out and make an appointment with your local urologist. We love talking about sexual dysfunction. And then there are additional resources. So, in the US specifically, there's an organization called the Sexual Medicine Society of North America, and that has a provider registry. So you can look up healthcare providers, who may be urologists, maybe gynecologists, maybe internists who have a specific interest in sexual health and sexual dysfunction. And those are great resources to find a provider through the Sexual Medicine Society of North America website. So I would say those are some great places to start. Yeah.
I love it. And as part of Stimulate Conversations, we always do a rapid fire question portion. And this is where I'm simply going to ask you some quick questions, and they're meant to be quick replies. So with that, we'll go ahead and start if that's okay.
Yeah.
Great. All right, perfect. So the very first question, I actually heard you answer it earlier, but I'm going to have you give sort of a quick reply for this one is, what does sexual wellness mean to you?
For me personally, it means, using my body to have a more intimate relationship with my husband and being more connected to him.
Love that. And how do you define good customer care?
Ooh.
So in your
Making
case,
somebody
patient
feel
care.
Yeah, making somebody feel seen and listening to them.
Love that. And what keeps you personally inspired?
My badass female urology friends who
I
are
love that
just
too. And what keeps you
yes,
professionally inspired?
the same.
Love
No,
that.
I want really, really good, high quality sexual health resources to be available to everybody. Healthcare and sexual wellness resources. So that professionally drives me.
And so what I'm also hearing is that you don't think they're good enough quite yet. So there's room for improvement.
There's a lot of amazing stuff out there, but there's room for improvement. And then there's also a lot of stuff out there that's not so great. And I think the voices for high quality, evidence based, wellness, lifestyle, and dysfunction interventions are, we need to support those.
Yeah, we absolutely support and adore that approach as well. And finally, what's the best advice you have for business leaders?
Oh gosh, I don't. Oh.
I know.
I mean, what can I say that hasn't been said by somebody better? I mean, find something that you actually care about and bring your unique voice to it. I think, me personally, going through my experiences as a physician, I was always trying to be something that wasn't necessarily authentic to me, right? So, when you're going through training, what's considered the best possible outcome for your career is to publish the most papers, right? And I realized eventually, once I had enough confidence and enough maturity in my career, to realize that publishing the most papers was not the authentic and most meaningful way for me to move through my career. It was actually being an approachable communicator and being involved in business and being emotionally available to my patients. And so I think whether you're in business or in healthcare or business and healthcare, don't try to be somebody else's version of success. Like, define for yourself what your strengths are and what success means to you, and follow that, and you will be more successful.
That
So
was fantastic advice. Thank you so much. And thank you so much for joining us
yeah.
to Stimulate Conversations. It goes fast. Our conversations are quick, but we hope to have you return again. So thank you so much, Dr. Winter. And we look forward to continuing the conversations of Stimulate Conversations digitally online. You can find us, of course, on YouTube and Spotify and in our private Facebook community. Thanks again, Dr. Winter. Stimulate Conversations offers year-round ways to stay in touch between our podcasts, including a private Facebook community for ongoing and more in-depth discussions, which you can find via Facebook at the group name Stimulate Sexual Wellness Business Discussions. You can also stay connected via Instagram at the handle Stimulate the Show. And you're welcome to email us at stimulate@retailminded.com. I'm Nicole Leinbach, founder of Stimulate and your host. And together with the entire Stimulate team, we look forward to continued discussions that will, you guessed it, keep you stimulated on the business of sexual wellness. Till next time, stay stimulated.